Mark, listen to this story that I just heard. Mustafa, good morning.
Good morning, sir. Happy Father's Day to everybody out there.
Thank you. Tell me your situation, please.
My situation happened in October of 2014. I was having a lot of leg pain, and they wanted to do surgery on my back. And when I went to get a checkup, final checkup for the surgery to make sure everything on my blood is okay, they thought the PSA was wrong because it was very high.
What was your PSA, and how old were you when you got the PSA?
I was 42, and my PSA was 125. And they thought the laboratory made a mistake. And when I came back again, I did a second blood test. It was 140.
Is there a family history of prostate cancer in you?
No. My father has a little bit of prostate cancer, but nothing where he had to have surgery. It was all done through oral medication.
And hold on, and they did a biopsy on you, right?
Correct.
And what kind of Gleason score?
It was pretty high. I don't have the results.
Okay, it was aggressive cancer.
It was aggressive cancer, and when they did the body scan and everything, it came out to where it was to my pelvis, to my ribs, and to my back and to my leg.
So at age of 42 already the cancer is spread to your bone?
Correct.
Oh my God. Wait 1 second. Mark?
Dr. Siegel is
all...
That's an incredible story.
Well, listen, this is a real story. This is not some made up. And Mustafa is not my patient. You can say it on national radio. I've never met you.
No, to cut you off, I was in a doctor's office, and like I said, I'm a New Yorker, and I always follow up the daily news. And when I read the Dr. David's story, I literally ran out of the office crying because this story that you put on the daily news, it reflects just exactly.
You mean the Peter Latos? So
yes,
Peter Latos.
Sorry to cut you off, doctor, because 2 years prior to that, I asked the doctor, "Can I get a PSA test?" And he told me, "No, man, get out of here. You're too young for this." Exact words. I'll never forget it. And if I did that test, I wouldn't probably be in the same situation where I'm right now.
Let me get a comment from our medical doctor, Dr. Siegel. Mark, what do you say to this, to Mustafa?
You know, the biggest tragedy here, in my opinion, outside of life issues, is that medical world is too focused on death rates only. In other words, oncologists try to keep people alive once they have metastatic prostate cancer, but you've got it spread to the bones. You've got pain. It's a really, really agony existence. If we can get a patient early enough through the help of a PSA, send them to a great surgeon like you, get the prostate cancer out. We're looking at a cure.
Absolutely.
Then you follow a PSA to make sure it's a 0 level.
Okay, listen, Mark, you and I have been talking about this, but you have U.S. task force that says don't worry about it until 55. And people like Mustafa, and I will do everything I can to help him, but already he's coming in with PSA of 120 at 42. And I just wrote an article actually on Life Science that in the future, in people like him who have genetic markers like BRCA1 and BRCA2, same concept of mastectomy that Angelina Jolie is doing, there are some prostate cancer patients such as this where we may even do preemptive prostatectomy early on before it becomes like this metastasis. As we are able to find these people earlier, as we do better genetic testing, as we're getting more and more tumor markers that will distinguish between low risk versus high risk, then we will be better. And for them to come and say, don't get PSA till 55, that's a huge disservice to a lot of men out there.
But I want to add one point to this, David, and your point about genetic testing is extremely crucial. But, the other point that the listener should know is you most of the time don't have symptoms. I mean, the prostate gland is buried deep in the body. By the time you have any symptoms, it's almost always too late, whereas the breast is something you can actually feel. I mean, we have to really be on the alert. That's why the PSA is a gift.
Mustafa, so where are you with the whole treatment situation?
Right now, I just started yesterday on Friday, Provenge, and my aunt Terry Mayer, God bless her, and and her sister, they're the ones who guided me through the best doctors in New York and through California. And ever since I'm in like a big time follower of you on Instagram and Facebook, and I've always been following you up. And I would love to be under your care because I just feel more comfortable because you're so on it, and I want to talk to you. What do you recommend? What's my next step?
I can tell you that on a humanitarian aspect, you have my full support. Unfortunately, as a surgeon, it's already too late. This is a kind of case where I wish we would have known about this earlier on. And I'm not saying that everybody should get their PSA when they're 30 years old, but every man out there should get a baseline PSA at 40. And then you look at to see what the trend is. And then you can have a discussion with your doctor whether you should go for biopsy or not, or what kind of recommendation you're going to get. But to put your head in the sand and wake up at 55 and then realize that it's already too late, it's just a nightmare. And I'm sorry that you're going through this.
Is there hope for me in the future?
There is definitely hope. There's definitely hope, and I will certainly help you to the best of my capability. We have great medical oncologists. We have to see exactly how far along this is gone. Fortunately, with prostate cancer today, we see more and more treatment coming in, whether it's Xtandi, whether it's Provenge, which is a vaccine.